Can we prevent women dying after childbirth? A life-threatening form of bleeding which occurs after giving birth, called postpartum hemorrhage. Postpartum hemorrhage is the number one cause of maternal death around the world, particularly in low and middle income countries. In March 2010, a global collaboration was formed to find better treatment for mothers who suffer from postpartum hemorrhage, called Women Trial. The aim was to determine the effect of early tranexamic acid administration on mortality, hysterectomy, and other morbidities in women with postpartum hemorrhage. A randomized, multicenter, double-blind, placebo-controlled trial was conducted among 20,060 women at 193 hospitals across 21 countries. The inclusion criteria were women with diagnosed postpartum hemorrhage following vaginal delivery or cesarean section, and exclusion on the basis of hypersensitivity or contraindication to tranexamic acid. Patient received 1 gram intravenous tranexamic acid or placebo at the rate of 1 ml per minute. Second dose was only considered if bleeding continued for 30 minutes or restarted within 24 hours of the first dose. Primary outcome was a composite of death from all causes of hysterectomy. Secondary outcomes were the effect of tranexamic acid on cause-specific mortality with death due to bleeding, surgical interventions, systemic complications, thromboembolic events, length of hospital care, need for mechanical ventilation, and status of newborn. The risk of death due to bleeding was significantly reduced in patients who received tranexamic acid. Tranexamic acid given within 3 hours of giving birth substantially reduced the risk of death due to bleeding. There was a significant reduction in laparotomy to control bleeding with tranexamic acid. Early treatment is the most effective and late treatment is unlikely to be beneficial. CRASH-2 trial enrolled 20,211 trauma patients, showing that tranexamic acid reduces death due to bleeding with no apparent increase in thrombotic events. In women trial, the early administration of tranexamic acid to women soon after delivery reduces death due to bleeding, and laparotomy to control bleeding in postpartum hemorrhage, about 1/3 cases with no evidence of any adverse effects or complications. The women trial has been awarded the 3rd winner prize in the Horizon Birthday Prize Contest by the MSD for Mothers program in recognition for its work on severe bleeding after childbirth. Tranexamic acid belongs to a class of drugs known as antifibrinolytics, treating heavy bleeding during menstrual period. It works by slowing down the breakdown of blood clots, which helps to prevent prolonged bleeding. According to WHO 2017 Global Recommendation Guidelines, tranexamic acid should be used in all cases of postpartum hemorrhage, regardless of whether the bleeding is due to genital tract trauma, uterine atony, or other causes. Tranexamic acid should be used during medical, non-surgical, and surgical interventions as a comprehensive treatment package. Tranexamic acid should be initiated within 3 hours and as early as possible after onset of postpartum hemorrhage. Every 15-minute delay decreases the effect of tranexamic acid by 10% with no effect after 3 hours. Tranexamic acid could save the lives of 1 in 3 mothers who would otherwise bleed to death after childbirth. This information is provided by Hilton Pharma for healthcare professionals.